Okay, we're almost done. Um, a few points that I like to talk about before we finish dermal formulation. Again, the skin is the largest and heaviest organ in the body and accounts for 70% of the person's weight. Most dermal dosage forms are used for local effects on or within the skin, and dermal administration has a number of advantages. For example, it provides an ease of administration not found with other routes, and the usage by parents is generally good. And you have different type of formulations, such as solutions, tinctures, colloids, and limates. So, what are the definitions of some of these terms here? One, dermal solutions and tinctures are generally used as anti-infective agents. Both are dispensed in small volumes. You can have what is called collodions, liquids and preparations of pyroxylin dissolved in a solvent mixture of alcohol and water. And when applied to the skin, the solvent rapidly evaporates, leaving a protective film on the skin that contains a thin layer of the drug. Other things that you have are ointments, creams, and lotions. Ointment, creams, and lotions are the most popular dermal formulations. Physically, they appear to be very similar in consistency and texture, but there are some differences. Ointments have drugs that have been incorporated into the base. Creams are semicelluloid emulsions and are less viscous and softer in texture than ointments. And lotions are suspensions of solid drugs in an aqueous vehicle. Another type of dermal formulations that we have are paste, plaster, and powder. Pastes are generally used for their protective action and for their ability to absorb secretions from skin lesions. Another thing that you should know that paste contains more solid materials than ointments and are stiffer and less penetrating. Plasters are solid or semi-solid adhesive masses that are spread on a suitable back-end materials. And then powders have different dusting and covering capabilities. Okay, so those are some of the definitions and characteristics you find associated with paste, plaster, and powders. Then you have what's called transdermal patches, tapes, and gauzes. The transdermal system, which consists of patches, tapes, and gauzes, deliver medicine to the skin for a systemic effect. The systems can be divided into two kinds: those that control the rate of drug delivery to the skin, and those that allow the skin to control the rate of drug absorption. Okay, something that you should be very familiar with. The first type is for more potent drugs, and the second type that I just mentioned is for less potent drugs. And then finally, you can have what's called dermal aerosols. Dermal aerosols generally used to apply anesthetics or antibiotics drugs for local effects. Some of the key definitions that you should be familiar with, and these are product formulations. For example, hydrates absorb water. Percutaneous absorption, the absorption of drugs through the skin, often for a systemic effect. You have stratum corneum, the outermost cell layer of the epidermis. Let me talk about that when we were discussing the different type of layers and where the needles go into. The highest layer is the epidermis, and then the outermost layer of the epidermis is called the stratum corneum. These are all dead cells. Okay, so let's talk a little bit about the basic rules associated with pre-cutaneous absorption. More drug is absorbed when the formulation is applied to a larger surface area. That makes sense. Formulations or dressings that increase the hydration of the skin generally improve absorption. The greater the amount of rubbing or injection of the formulation, the greater the absorption. And the longer the formulation remains in contact with the skin, the greater will be the absorption. Certain key facts associated with dermal formulations. Again, we have talked about this, but just a quick review. Hydrates absorb water, cutaneous absorption, the absorption of drugs through the skin, often for a systemic effect. And stratum corneum is the outermost layer, cell layer of the epidermis. Finally, let's talk about vaginal administrations. Vaginal administration have many of the same characteristics found with other parenteral route of inflammation. Formulation for this route of administration are solutions, powders, for solutions, ointment, creams, aerosols, suppository tablets, IUD. Okay, so vaginal formulation avoid derogation that occur with oral administration. Derogation is talking about the breakdown of a particular solid, which occurs usually inside the low pH of the stomach. It has a potential for providing long-term drug absorption. Can have variable drug absorption due to physiological changes, tendency of some drug formulation to be expelled can occur. Okay, so there are many different types of formulations, and we're going to just go and touch upon them. Let's look at tablets. The vaginal tablets are called inserts, and the same activities are inserted in the same manner as vaginal suppositories. Okay. Then you have ointments, creams, and aerosol forms. Vaginal ointments, creams, or aerosol forms typically contain antibiotics, estrogenic hormonal substances, or contraceptive agents. Creams and forms are placed within a special application tube, and the tube is then inserted high in the vaginal tract. The applicable plunger is depressed to deposit the formulation. You can have vaginal suppositories that are used as a contraception, preventing hygienes, antiseptics, bacterial antibiotics, or to restore the vaginal mucosa. Then you have what's called IUDs. IUDs are used for long-term drug therapy, and they can be very, very effective in terms of preventing pregnancies. All right, so solutions, powders for solutions, aerosol forms, IUDs, ointment, creams, suppositories, and tablets are all vaginal formulation possibilities. Okay, so we talked about this, and so this will be just a review. Vaginal tablets are also called inserts. Patients should be instructed to dip the tablet into the water before insertion. Patients may want to wear a sanitary napkin to protect nightwear and bed linen. Ointment, creams, and aerosol forms contain antibiotic, estrogenic hormonal substances, or contraceptive agents. Creams and forms are placed in a special applicator tube, and the tube is then inserted high in the vaginal tract. IUDs, intrauterine devices, have a lower rate of vaginal expulsion due to their similarity to the uterine shape. They also have a higher surface area of copper and effective at a rate of greater than 99%. There are some that can last way for almost a decade. You have what is called a Mirena. It's not a category of IUD that is based on the release of hormonal progesterone. The vaginal ring, a hormone-based IUD used in 1 month cycles. The ring is inserted in the vagina for 3 weeks. removed for 7 days and reinstated. We have what's called the NaviRing as such a device. And that's the end.